Let's bring in now Dr. Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security. So, Dr. Adalja, let's talk first about what Megan was talking about in the crisis in California, preparing for this holiday surge upon a surge. So for the nearly 1.3 million people who passed through American airports yesterday, what do they need to do now? How long should they quarantine, and when should they get a test?
Everybody that traveled during this holiday really needs to think of themselves as being significantly exposed, because there's so much level of community spread going on that it's very, very hard to avoid anybody that's been infected or carrying this virus. So you should wait probably about 5 days since your exposure and then get tested. And then if you're negative at day 7, then you can kind of start to open your circle a little bit. You have to be very meticulous, looking for symptoms, keeping in touch with people that you were with during your Christmas gathering to see if any of them have developed symptoms or if anybody tested positive. All of that's going to be really important to keep this to a minimum.
Dr. Adalja, let's talk about what Vaughn was reporting there. The U.S. set a goal for 20 million vaccinations by the end of the month. We're way behind that right now. NBC reports nearly 2 million people nationwide have gotten the vaccine, including you. Congratulations. What's the holdup here?
You have to remember that Operation Warp Speed was all about development of the vaccine, and now delivery is the harder part, and that's not necessarily something that can be sped up that quickly, because hospitals have their own timescales, long-term care facilities have their own timescales of how they're going to vaccinate, and there's a lot of logistical challenges, especially if you're a hospital that's inundated with COVID patients and you have staff out sick. You have to set up these clinics, you have to watch people for 15 minutes or maybe 30 minutes after they've gotten their vaccination. So from a logistical standpoint, hospitals were initially going slow. It's starting to ramp up, but we probably will not get to 20 million people by the end of the year. I think we'll get there eventually, and we're on a good schedule, but it's not something that I would wed myself to some specific date or specific number, because we have to expect there's going to be hiccups and glitches when you're doing such a Herculean public health task as vaccinating the country and even all of the healthcare workers.
Yeah, there was video of you getting that early Christmas present there. So quickly, Doctor, does that mean that President-elect Biden's promise of 100 million shots in his first 100 days in office is untenable?
It's not necessarily untenable. It's in the realm of possibility. And what we're seeing right now is hospitals are ramping up. Vaccinations have gotten faster every day because they're getting much more used to doing this. They've got the staffing, they've got the logistics down. So we may get there, but I wouldn't kind of promise something that I don't think that is 100% sure that's going to happen. I think that we're going to see that many people vaccinated over time, but I don't know if I would set to a date certain, because there's bound to be hiccups that you can't anticipate when you're doing something this big.
In the realm of possibility. So you're saying there's a chance. Dr. Adalja, thank you so much. Good to see you.